This is Dr. Eric Fishman for EHRtv, and we're in New Orleans at MGMA 2010, and I have the pleasure right now of speaking with Evan Steele, CEO of SRSsoft. And Evan, thank you very much for spending a few minutes with us. SRS has a wide variety of clients, and if you could just tell us briefly about that. I'm going to speak with you about certification issues for a few moments as well.
SRS focuses on typically the high-volume, high-performance specialist market, orthopedics, ophthalmology, dermatology, cardiology, the practices where productivity in the exam room is key. And it's been on market for the last 13 years since I started the company in 1997 with my brother, who's an ophthalmologist, and it still remains our focus, highly productive, high-volume practices.
I understand you consider yourself a bit of an efficiency expert, and you really look to see how many clicks, and not only how many clicks it takes something to do, but we've discussed in the past how far you have to move the mouse to make that click.
Correct. Time in the exam room to us is hallowed ground. From a business perspective, time in the exam room generates all revenues for a physician, whether it's procedures, surgeries, ancillary tests, labs. So we just focus on the exam room and the clinical areas and make sure that they're as efficient as can possibly be. Because as you know, the larger trends in healthcare are declining reimbursements and increasing costs. So the business of medicine is becoming a much lower margin, high volume business. So our goal is to accommodate the needs of physicians to manage their productivity on the revenue side so they can maximize revenue, and manage their costs on the cost side so they can maintain their incomes.
Very true, very true. Let's now segue, if we could, into certification, a subject very dear to your heart. If you could tell us about your thoughts on certification in the past, present, and maybe in the future.
Unfortunately, certification for the specialty groups that we service so well is very primary care focused. If you read the meaningful use,
the 800 and some pages?
800 and some pages, many of which I've read. I haven't read all of them. But it has a very, very sharp primary care focus. In fact, a new committee has been formed to review stage 2 meaningful use, and there's 24 people on the committee, 18 of which are doctors, and there's no surgical specialist on that panel on that committee. So it's very clear that it's a primary care program, not as applicable to the specialty practices like ophthalmology and orthopedics and dermatology.
And the regional extension centers are aimed also at small primary care practices. It's clearly there's a government initiative in that direction, more so than for specialties.
Correct. Right in the mission statement of the RECs, it says to service 100,000 primary care practices, mostly in the rural areas.
Evan, obviously there's a tremendous amount of momentum nationwide for physicians to be eligible for stimulus funding. And in order to do so, they need to be using a certified product. Now, you've gone on record in the past as indicating that efficiency in the examining room is paramount, in your opinion, and more important than certification for your clients. And while that may be true, is it possible to have efficiency in the office examining room plus certification? And is that something that you're thinking about?
Yes, we're actually going to get certified in 2011 to address the concerns of our clients that while they're looking for productivity, they're uncertain about the future. And they're not sure about other payers or the government or how they're going to handle meaningful use going forward. So we've made a strategic decision to provide meaningful use certification in our software. So if our clients decide at some time in the future to go down that path, they will be able to.
Very good, and an interesting change from your perspective, as I understand it. As I understand it, there are 3 certifying bodies at this point in time: CCHIT, InfoGuard, and Drummond. Have you made a decision as to which of those you'll be utilizing, and if so, why?
We haven't decided yet.
Okay. Evan, I understand that you've recently had a very large implementation. If you can tell us about that briefly.
There's a group out in Illinois, in Chicago, Illinois. It's a 242 provider orthopedic group. It's called Illinois Bone and Joint Institute. We had a pilot program with 150 users and 14 providers. It was a smashing success. And just recently we signed the contract and announced it in the press.
And that's your largest installation, I believe.
Up to now, yes, that's our largest implementation at 242 providers.
Congratulations.
Thank you.
This is Eric Fishman for EHRtv. We've had the pleasure of speaking with Evan Steele, CEO of SRS. Thank you.